Today's skill is going to focus on tracheostomy suctioning. So this is typically done for a patient who already has a pre-established tracheostomy and needs suctioning based on their respiratory rate, their lung sounds. So we have some idea that there are some secretions in their respiratory tract that need to be suctioned out, and they are having a difficult time clearing this themselves. So supplies that you're going to need, it's going to be a stethoscope. You're also going to need a paper and pencil for communication. You're going to need some non-sterile gloves. You're going to need your personal protective equipment, which will consist of a gown. Also, you're going to need some type of face protection, so that can include a face mask that already has the eye shield attached, or you could simply use the mask and then include a pair of goggles with that as well. Some of that depends on your facility, what type of equipment they have. You're also going to need your suction kit, and again, this is going to depend on the facility. The one that we're going to use today is similar to this one, and that's the one that you'll typically be using in check-off or in practice. And so it already has the suction catheter, some sterile gloves, and your saline already in it. However, you may see at clinical a different type of suction kit. So this one's a suction catheter kit, and for just demonstration purposes, I'm going to go ahead and just take everything out, even though I'm not sterile, just to show you what's inside of that. So in this type of kit, there is a pop-up box that we would open. We would take our bottle of saline, of course lip it just like we normally do for any other skill, pour the saline into that container. Inside of this we have one sterile glove, so that means that we are going to need another glove, and then also our suction catheter is located in here. So if you look at the packaging for this one, it says one glove. So again, make sure that you're reading your packaging of the supplies that you're using so that you don't forget anything to take into the room. So we're going to set this to the side. Other supplies that you're going to need are going to be a towel and a red bag. So if you look at your skill manual, number 1 says to confirm the order. And again, we always have to have an order for the skills that we're going to perform on patients that are invasive. For this skill, typically it is not ordered on a routine basis. It's typically ordered PRN. The reason behind that is that if it's ordered routine, the more we suction a patient, the more secretions that the body produces, which could cause their condition to worsen. So this is done when we assess the patient and see that they are having some difficulty in their breathing, they're having some adventitious lung sounds. So to follow along with the lab manual, after we confirm our order, of course we're going to gather our supplies, we're going to go into the room, introduce ourselves, let them know our name, our status. You know, I'm Ms. Shoemake today, I'm your nurse, I'm going to be performing tracheostomy suctioning on you. We're also going to identify the patient, checking their armband against an equipment sheet or something else that lets us know that this is the correct patient. Name and birth date is how we're going to verify identification. We're going to explain the procedure, why it's to be done. We're going to wash our hands. We may need to perform some type of teaching, especially if this is the very first time that this patient has had suctioning performed. They may have a lot of questions and they may not fully understand. So just be prepared to teach your patient about the skill that's going to be performed on them. Next thing that we're going to do is we're going to raise the bed for good body mechanics. So remember that when we're raising the bed, we always raise the rails. So that side has already been raised. So we're going to raise this other side. Raise the bed up. So again, I've got everything ready, I've washed my hands, we've already spoken to our patient, they understand what we're doing, so we're going to start getting into the skill. Next I'm going to go ahead and lower the side that I'm working on. Next I'm going to perform an assessment on my patient. Some things that I want to assess are going to be the respiratory rate, the O2 saturation, and the lung sounds. The reason we're performing it before the skill is it's going to serve as our baseline. After we've performed suctioning, hopefully what we want to see is that the lung sounds have cleared, the respiratory rate has decreased, and the O2 saturation has increased. So this information is going to serve as our baseline to see if this skill has done any good for our patient. So we've done our assessment. Remember that when you're doing lung sounds, when you're checking those, remember that you're going to always go underneath the dressing or gown. It's right on the skin. We're going to check anterior, posterior, side, and listen to all lung fields, moving right to left, comparing each of those. So we've done all of our assessment. The next thing that we're going to do is we're going to put on some non-sterile gloves because we want to check their tracheostomy site. Things that we're looking for: any redness, any edema, any drainage. So we're just checking that site with our gloved hands, making sure that it looks normal. Okay, there's no redness, there's no swelling, there's no drainage. So after I've done that, I'm going to take off my gloves, put up my rail, go wash my hands. Okay. The next thing I'm going to do is get all of my equipment ready where it can be reached. Again, this is going to be a sterile procedure, so one of the main things anytime you're doing a sterile procedure is getting that sterile field within your site. So just fix your table where you can perform the skill but still see all of your sterile equipment. I'm going to go ahead and put my red bag in the garbage can. I'm going to put my patient up in a semi-Fowler's position. I'm going to place a towel on their chest, and this towel is to protect their clothing. Sometimes when you're suctioning and you bring the suction catheter out from the tracheostomy, there's some secretions on the tip end, and we don't want to get that onto their clothing or to their skin. So we're going to protect their skin and their clothing. The next thing is promoting the patient involvement. So this is providing them some means of communicating with us. And this can be a pen and paper, so placing that within their reach. Or it could be a hand signal that if they get into distress and they need to let us know to stop or pause, they can raise their hand, blink an eye, whatever works for you and the patient that you agree upon. Next, we're going to assess their tolerance. Again, making sure that they can handle this right now. Is there anything else going on that may prevent us from performing tracheostomy suctioning? And again, because we're dealing with the airway, typically there's not a lot that's going to prevent us from doing that because we always know that airway is our #1 priority. If we haven't already done so, we're going to provide paper and pencil. Also, before we get started, we're going to test our suction machine. So that's just going to include turning it on, making sure that we've got some suction. You can test it with your finger and you can hear. You may just want to place your suction tubing within reach. We're going to turn off the machine for right now. The next thing that we're going to do is we're going to don our personal protective equipment. So I'm going to go ahead and put my gown on. Also at this time, I would go ahead and put on my mask or my face shield. For me to demonstrate, I'm not going to put on the face shield because you won't be able to hear me very well with the mask on. But at this time, I would go ahead and take it out of the package, remove that backing, and then go ahead and place it on. So I'm going to set this to the side because we're going to be dealing with a sterile field. Okay, so ours already has the prepackaged saline, so we're going to put this up to the side as well. So again, what we want to have on our table is just the equipment that we're going to be needing. So the next thing that I'm going to do is I'm going to go ahead and open my suction kit. And remember that when you're opening packages, you open away from you. Just peel it back. Typically the gloves are inside, so I'm going to go ahead and take them out without touching anything else. I'm going to move. Remember that when you're doing sterile technique, you can use your whole table and use the field so that you don't cross over your sterile field at any time. So I typically kind of slide down here to the side. I'm going to open my gloves. Sometimes you just have to work with them a little bit. Remember when you are donning sterile gloves that you glove your dominant hand first by picking it up from the cuff. And I usually just pull mine up, kind of maybe take a step back so I don't risk touching my sterile hand with the table or anything else that's non-sterile. Pull that over. Then the other one I'm going to go inside the cuff. Again, trying to separate just a little bit. Pull it up, step back, go ahead and put that in. And remember you hold your dominant thumb kind of back so it's not touching anything that's non-sterile. Next we're just going to adjust our gloves. Don't worry about the cuff folding up too much because we're not going to be utilizing that part, and sometimes when you try to get that cuff unfolded you risk contaminating your glove. So I'm going to put my hands together, and this is something that I typically do anytime I have sterile gloves on and I'm not using them at this second. I'll just go ahead and clasp them so that keeps me from touching anything. So the next thing, I'm just going to get rid of my packaging. The next thing that I'm going to do is I'm going to get my kit, and inside of the kit what you'll notice is that you have just a cardboard, and that can just go to the side. You also have your sterile saline, and you can do this a couple of different ways. Number one, you could keep it in the package and just go ahead and unscrew the top. And remember, everything inside of here is sterile. My gloves are sterile. Okay. At this time, if you wanted to go ahead and take it and set it out, or you could have done that before you opened it, it's really up to you. The next thing that we're going to do is we're going to grab our suction catheter, and it's kind of long just to make sure that it doesn't get onto anything that's non-sterile. Just kind of typically pick it up and wrap it around your hand. The next thing that we're going to do is now we're going to attach our suction catheter to the tubing, and what you want to do is you want to keep your dominant hand sterile. Your dominant hand is the one that's going to be holding onto the tubing, feeding it down into the tracheostomy. So that's why with that one kit that I showed you, it only has one glove, because we're going to put that sterile glove on your dominant hand, and your non-dominant hand can just have a clean glove on. Okay, so I've got it in my sterile hand. So the next thing that I'm going to do is I'm going to attach it. So all you're going to do is take the tubing, take the catheter, kind of screw it in there. You're holding the rest of the tubing in your dominant hand. Then what you're going to do, still keeping that dominant hand sterile, is you're going to take your non-dominant hand, go ahead and turn your suction machine on. Then you're going to move your hand up, your non-dominant hand, your non-sterile hand, and this is what's going to place the suction on. You can kind of hear it. Okay? And so again, the tubing is what's going to go into the patient's tracheostomy. So we're going to apply some suction and pull some saline just into our tubing. At this time, we're getting ready to place the catheter down into the patient's tracheostomy. So a couple of things need to happen before you actually place the catheter down inside the tracheostomy. First of all, if your patient has oxygen, then what you want to do is you just want to take your hand and move that oxygen. It's typically going to be the tracheostomy collar. You can just move it down to the side or down below it so that it's out of the way so you can put the catheter in. If they don't have any oxygen, you just want them to take a couple of big deep breaths in and out. Okay, and again, that's to oxygenate those lungs before you put the suction catheter in. Next, what we're going to do is we're now going to put the suction catheter in, and it needs to go about 5 to 6 inches. So at this time, our finger, our thumb, is going to be off of the suction control. So you can just put it right down below. We're going to go in about 5 to 6 inches. Just feeding it through there. Okay. Once we get about 5 to 6 inches, then what we're going to do is simultaneously we're going to apply suction off and on, and we're going to twirl the catheter as we are bringing it out. Now this should not last any more than 10 seconds. So again, it is applying the suction intermittently while twirling our catheter. Again, that's to get those secretions that are around the tube. At this time, if the patient had oxygen, we would put it back on them or have them take a couple of deep breaths again. Depending on what their status is, they may need to be suctioned again. If that's the case, then we're going to clear the tubing, get those secretions through the tubing. We're going to go back in our 5 to 6 inches. With our thumb off of the controls, once we get it to 5 to 6, intermittent suction, whirling our catheter, again, no more than 10 seconds at a time. If we were complete at this time, we got most of the secretions, we're going to clear our tubing, rinsing it. If they had oxygen on, make sure that we're replacing that. We're going to turn off our machine. Take our catheter from our tubing. Take our gloves off, and I typically just wad my gloves, my catheter into my gloves. Throw it into our red bag. I'm going to go ahead and take my personal protective equipment off. I'm going to put up the rail and go ahead and wash my hands. Then, in order to complete the skill, some things that we're going to be doing, we're going to get them in a comfortable position, whatever is comfortable for them. Take the towel off. Make sure that they have their items within reach, their water pitcher, whatever they need. We're going to reassess their respiratory status. So again, we're reassessing their O2 saturation, their respiratory rate, and their lung sounds. So again, comparing that to baseline, and again, all that should be improved. We're going to raise the side rails, lower their bed. Once we get the bed to the lowest position, we're going to raise the lower the rails. So I would go on that side, lower that rail as well. Make sure that they have their call light within reach. They have their pen and paper. We're going to wash our hands again because we're probably going to go see another patient. And then we're going to document. So information that we're going to document is going to be the baseline vital signs or baseline data that we retrieved. We're going to document the tracheostomy site, the peristomal area, what does it look like. We're going to document that we performed trach care, the secretions, their description, what do they look like, how many times we had to suction. We're also going to document our post-suctioning data, again their lung sounds, O2 saturation, respiratory rate, and then if they had any oxygen, we're going to document regarding that. And that concludes this skill.